Hello, I'm Everett Vokes. I'm chair of the Department of Medicine here at the University of Chicago, and it is my pleasure to welcome you to the Center for Chronic Disease Research and Policy's 10th annual symposium entitled The Art and Science of Public Health Communications. I was present when this CDRP was first imagined and developed, and it's really been a pleasure and wonderful to see over the years how the center has evolved and expanded under the leadership of Dr. Albert Huang, who of course has been a long-term faculty member here at the University of Chicago. The global challenges of addressing non-communicable disease is greater than ever, and ironically has been magnified by the communicable disease of COVID, that pandemic that so much showed us that interplay between pre-existing chronic conditions, chronic health, and acute issues such as a pandemic with a new viral agent. And we've realized that now more than ever, we need research like that, which is supported by the CDRP, to reduce the health and economic burdens of these conditions. The CDRP is a nationally recognized center for research and policy on chronic diseases with a unique range of research that includes the development of innovations for preventing and treating chronic diseases, evaluations of the economic and policy implications of those innovations, and the linkages of these findings to the study of broader healthcare policies. I want to highlight some of the accomplishments of the center over the past 10 years. Recently, through a $20 million grant funded by the National Institute of Minority Health and Health Disparities, Dr. Wang and colleagues at Rush University Medical Center have created the new Chicago Chronic Condition Equity Network, or CENE, to find community-focused solutions to reduce health disparities in populations with multiple chronic conditions. Additionally, the center has been instrumental in acquiring and analyzing national data dating back over a decade from Medicare and Medicaid, an incredible resource that benefits investigators across the university. This data has allowed CDRP researchers to use national insurance claims data to study healthcare delivery across the United States for a series of studies evaluating the performance of the Health Resources and Service Administration's Health Center program to inform its future decisions. The center has also launched a training program, the Pitch Fellowship, to nurture the next generation of primary care clinical investigators to improve health outcomes and access to care for patients with chronic diseases from underserved backgrounds. Funded by HRSA through a grant acquired by Dr. Nida Latirapong, the program mentors 4 fellows from diverse backgrounds each year and offers them the opportunity to complete a Master of Science in Public Health Science for clinical professionals through the University of Chicago Department of Public Health. Through targeted studies, such as Dr. Latirapong's 2018 publication on diabetes and aging, researchers at the center have also demonstrated how crucial it is for patients to receive care early and often. And through Senate testimony, media interactions, and advisory panels, Dr. Tamara Kunetska has been a leading voice on the evidence behind nursing home COVID-19 cases and how this research can translate to policy. The center is now focused on 3 main research cores: a practice-based research network founded in 2018, which partners with UChicago Medicine to bring the newest research directly to patients and the communities where they live, a claims data research core that synthesizes Medicaid and Medicare data to improve policy and thus care for individuals with low incomes, and a cost-effectiveness analysis and medical decision-making core that evaluates existing programs and forecasts future spending on chronic diseases to guide policy decisions. I have been really thrilled and elated to witness this ongoing research and the many milestones achievements in the CDRP, particularly on this 10th anniversary. So congratulations on 10 years of great work and impactful investigations, and welcome to all of you who have convened here to celebrate and to learn. Many, many thanks.